Gibb. Thank you for being with me today. I've had quite a few patients recently that have been diagnosed with H. pylori by a breath test, typically, and they come to me, what is the best treatment? What can we do naturally, and what should we use with antibiotics? So the typical way to treat H. pylori it's called triple therapy. And the triple therapy mainly consists of like Prilosec, amoxicillin, and Biaxin. But there are varying countries throughout the world and the United States where eradication of H. pylori is getting less and less. So that's to resolve that H. pylori strain of bacteria. And so I looked up a few more recent articles here about H. pylori and treatment and what we can do about that. The first one is from the journal Gut Liver from August of 2019, and this is Stanford University in Stanford, California. So there are two different things you have to look about with H. pylori. The first is a pre-malignant condition called gastric intestinal metaplasia, and that's just where those cells start changing, and then if those cells continue to change, then you can actually get gastric cancer from that. So H. pylori is the most common etiologic agent of this gastric intestinal metaplasia worldwide, and it's the third gastric cancer is the third leading cause of cancer-related mortality globally. So they're always looking at how can we get rid of this. And one of the things that a couple other countries have done is they've set up, like Asian countries have set up established population level programs for the screening and surveillance of the pre-cancerous guidelines, and the same thing happens in Europe. But one of the things that they did show that there's no set standard surveillance in the United States. So that's the first one. The second abstract I was looking at, it's the analysis of virulence factors and antibiotic resistance between H. pylori strains. And they checked, what they did was they evaluated if you do the biopsy from different parts of the stomach, does that make a difference? And the upper stomach is called the body, and the lower stomach is called the antrum. So individuals can be infected with more than one strain of H. pylori bacteria. And they said that the differences between these co-infecting strains has not been well analyzed. So this study aimed to investigate the virulence factors and antibiotic resistance of H. pylori between different locations of the stomach in the same patient. And this was actually an article, the author is CEO, was the first author noted here, and this is from South Korea. So what they found was that people that were infected with the H. pylori can be more, like I said, more than one strain. So they checked 80 patients as part of this that were co-infected by two strains of H. pylori. 10 of the patients had two different strains. So among the 10 pairs, they had antibiotic resistant patterns were detected with clarithromycin, which is Biaxin, quinolone, which is another class of antibiotics, and metronidazole. And the differences in these different factors were detected. So what they found was, and what their main thing was, if somebody just goes to treat with only one strain of the H. pylori bacteria detected, then that can lead to less eradication of this complete resolution of this bacteria in the gut lining. So now we're getting into some other things that what potentially can help eradication. And this is from Advanced Pharmaceutical Bulletin in 2019, and it shows the gastroprotective effects of ginger and H. pylori positive functional dyspepsia, and that's pain, painful abdominal pain. Is from Iran. This study's from Iran, and Dr. Attari was the first listed author. The present study was trying to see the effect of ginger powder, and they used it in a tablet, 3-gram tablets, for 4 weeks to see if this would benefit the eradication rate. And they showed on the results that significant H. pylori eradication rate of 53.3% must be a lot higher than what they typically get. And their conclusion was that ginger is a useful complementary therapy for functional dyspepsia, specifically with symptoms of nausea and vomiting. So that was something that we could also use in addition to the triple therapy for H. pylori. Now, the last article that I pulled was about using berberine combined with triple therapy. Remember, triple therapy is Prilosec, amoxicillin, and Biaxin is the triple therapy that most people start with. And so, but using berberine for the assessment of eradication or getting rid of this H. pylori infection. So they had a meta-analysis, and there was a huge group of people studied with triple therapy if it could improve the eradication rates of H. pylori. The one thing that they found was using berberine with the triple therapy, the eradication rates of H. pylori were 95%. They never established a pre-treatment eradication rate on here, but 95% is pretty good. When you look at the eradication rate, when you look that up, it can be anywhere from 70 to 95%. So adding berberine, which can be an anti-bacterial agent also, and it also lowers blood sugars, so you can get both of those benefits from it. So that's the last part of the study. So if you would like to talk with me about H. pylori, if you've ever been diagnosed with that recently, what would be the best way to treat you, along with we have H. pylori. We have Pylori Essentials, which has berberine in it, and some bismuth and zinc, which actually help that surface lining heal, because it's very painful when you have H. pylori. And of course, you never want that to progress to have gastric cancer. So thanks for being with me today, and let me know if you need any other further help. I'd be glad to help you on your journey to good health. Thanks for watching. If this information was helpful, hit that thumbs up button down below. If you want more videos like this, hit the subscribe button down below, then ring the bell next to it. Also, if you know other people that you would want to share this link with, please do so, because I would love to help them on their journey to good health.